Welcome to our COVID-19 daily report for today, December 17th. I am Kathleen Aswetacho. The cutoff time for the data presented in this daily report is 1 p.m. It includes information reported within the last 24 hours. A total of 821 samples were tested. Out of this, 119 samples have resulted positive for COVID-19. There are 311 individuals newly under investigation. Today, we also report that 41 infected persons are hospitalized. Unfortunately, 4 of these individuals are being treated at the intensive care unit. Sadly, there is 1 new death to report. We would like to bring to your attention today's number of recoveries. A new protocol guided by the World Health Organization now redefines the method of determining whether a person is recovered. Before, a negative PCR test result was needed for a person to be declared recovered. With the new protocol, individuals are declared clinically recovered 14 days after testing positive, assuming they present no signs and symptoms. Today, 151 cases were recovered, and applying the new definition, the new cumulative total of recovered cases is 8,053. This number includes persons who are pending results from the Central Medical Lab, persons last to follow up who were never retested, and any other person whose sample was not processed for any other reason. As we move forward with the expansion of testing using rapid tests and reports coming in from the private sector, you will notice an increase in the numbers of confirmed cases and the total tests done. Additionally, this report is cumulative since March 2020 when we had our first case. Applying the updated definition for recoveries, the new total of active cases now stands at 1,526. These are those persons who have been confirmed and are within the time frame to transmit the virus. To date, 52,217 samples have been tested nationally. Out of this, 9,791 samples have resulted positive for COVID-19. 530 individuals are under investigation. A total of 213 deaths have been reported, but we are pleased to report that there are 8,053 total recoveries. The heat map shows the districts mostly affected. The greatest number of cases are seen in Belize, Cayo, and Stand Creek. Belize reported 47 new cases, with Belize City responsible for 35 of those cases, followed by Cayo District with 32 cases spread throughout the district. Stand Creek reported 15 new cases, and Dangriga responsible for 6 of those cases. Toledo reported 10 new cases spread throughout the district, and Bella Vista responsible for 5 of those cases. Orange Walk and Corozal have seen 8 and 7 cases respectively. The Ministry of Health and Wellness urges the public to wear a face mask properly, maintain consistent physical distancing, avoid social gatherings, and wash and sanitize our hands often. Please be safe and stay at home unless conducting essential business. Let us join forces in the fight against COVID-19.
Hello, my name is Edgar Na. I am a biostatistician at the Epidemiology Unit at the Ministry of Health and Wellness. I will be explaining how we populate the infographics you see every day so that you may better understand how we arrive at those figures. The data is obtained from the Belize Health Information System and from private facilities that have been authorized to perform rapid tests. The reporting cutoff time is 1 p.m. every day. Total tests done is the cumulative total of all tests done that have received results. This includes both PCR and rapid tests. Total confirmed cases is the total number of persons that have received a positive result for the first time. This would also include any reinfections that occur. Total negative tests is the total number of persons that have received a negative result. This excludes negative follow-up tests. Since this measures the number of people who were at risk of contracting the virus and tested negative, persons that have tested negative multiple times would be counted more than once in this total. The overall positivity rate can be calculated in multiple ways. The method we use currently is to divide the number of confirmed cases by the total number of persons tested multiplied by 100. The total persons tested is the number of persons who are at risk of being infected that have received a result. The way this figure is calculated is adding the total confirmed cases to the total negative tests. Total recoveries is the number of patients that have been classified as recovered, either clinically or by a negative lab test result. Due to new protocols, individuals that have passed 14 days since the onset of symptoms and were currently without symptoms or had little to no symptoms during the period will need to receive a medical evaluation and at the discretion of the medical officer would be classified as clinically recovered. Under investigation is the total number of samples to be processed by a PCR test. Percentage recovered is the number of recovered patients divided by the total confirmed cases multiplied by 100. Active cases are all the confirmed cases that have not been classified as recovered and are considered infectious and so must adhere to quarantine measures such as self-isolation. Total deaths reported are all those individuals who have a confirmed test and that have died as a result of complications arising from COVID-19. The case fatality rate is the total number of deaths divided by the total number of confirmed cases multiplied by 100. Regarding the daily report, these figures display the increase in numbers from the day prior for each field. Active hospitalizations is the total number of confirmed COVID-positive patients currently admitted to a hospital. ICU admissions are a subset of the active hospitalizations and are those patients in intensive care at the Carl Huchner Memorial Hospital. This includes those patients that are on mechanical ventilators and those receiving high-flow oxygen. Newly under investigation is the number of new samples received within the past 24 hours that are pending a PCR test. New deaths reported is the total number of deaths confirmed to be as a result of complications arising from COVID-19. This number does not always reflect the number of deaths that occurred in the past 24 hours, but instead the number of deaths reported on that date up to the cutoff point. These figures have undergone a lot of data processing and validation in order to deliver the most accurate information. As we learn more about COVID, protocols will change and this will affect how the data is calculated and populated to produce these infographics. We work every day in order to keep you, the public, duly informed with the current situation. As we continue to combat the virus, we must realize that it is a group effort that is necessary to overcome these challenging times. We ask everyone to wear their mask properly, maintain social distancing, wash your hands properly and regularly, and sanitize often. Only together can we get through this. Let us join forces in the fight against COVID-19.